Are you afraid of COVID? I'm not afraid of COVID. For hundreds, perhaps thousands of years, there has always been one pandemic after the other. The plague, the bubonic plague, all kinds of natural viruses and bacteria and germs that will attack humans. So we'll always have these pandemics and these plagues and these diseases and these infections. If it's not one, it's the other. Now, why am I not afraid of COVID? It doesn't mean that I don't take precautions. I sure wear my masks. I wash my hands regularly. It is something we should all be doing, whether we have COVID around or not. We should be diligent about washing our hands. I remember when I went to nursing school, they taught us that the single most important thing to do to prevent the spread of infections is to wash our hands. I practice social distancing as best as I can. Sometimes people come up to you, and well, that's why I try to wear my mask all the time. So I'm not foolish, but I will not be afraid of COVID because just the fear of COVID alone creates a stress and anxiety on our mind and our bodies. And that could potentially lead to a lowered immune system. So I have accepted that COVID might be around forever or for a long time, like influenza, for example, the flu. There's a flu season, and there might very well be a coronavirus season. We don't know. Well, this is my take on COVID. Clearly, based on the information we've received from the CDC and from the media, the folks that are most vulnerable and have succumbed to COVID are those that have comorbidities. And the comorbidities of diabetes and heart disease and kidney disorders and Alzheimer's and a lot of these chronic illnesses that folks have, bronchitis, emphysema, these pre existing health issues make us more vulnerable and more predisposed to having a negative outcome if we are exposed to COVID. So, this is what I have decided to do. And it's something I've practiced for a long time. I'm just being a little more diligent with it. I want to make sure that I take the best care of myself. Now, what does that look like? I eat nutritious food and I am more diligent about it. So I am making sure that every day I have nutritious vegetables and fruits. And lime and lemon are very high in vitamin C. Um, those colorful foods like tomatoes and the peppers, they're very high in vitamin A. I make sure I get some sunlight for vitamin D because these three vitamins, C, A, and D, many research has shown that these vitamins help us a lot with our immune system. I think I got exposed to COVID while I was in New York for my granddaughter's birth. Because when I got home, I was quite sick. So, what I did, I went on a 3-day fast, just water. For 3 days, I rested and I would take short walks in my backyard in the sun frequently during the day. A lot of rest. I fasted for 3 days just on water and I would get exposure to the sun. And about 3 days into that, I felt perfectly fine. I'm not suggesting that that will be everybody's result. What I'm suggesting is that COVID will have a lesser impact on us if our immune system is rock solid. I have a number of friends that are nurses that work in intensive care, and they tell me that one of the protocol that has been implemented in the intensive care and in the hospitals for COVID patients is high amounts of vitamin C and zinc. Okay, and you get zinc from your nuts and your vegetables and your seaweed and things like that. High vitamin C infusions and zinc. Okay, and doctors have been checking patients' vitamin D level now for a few years and putting them on supplements. So that's probably part of the protocol also. But for sure, vitamin C and zinc is part of the protocol. For even I heard President Trump, that was in his treatment regimen. So, nutrition to tank up our immune system. Exercise helps our immune system. Decreased stress level helps our immune system. Good sleep helps our immune system. Nice clean water helps our immune system. So, what I have decided to do, I'm going to make sure that I am in the best health by addressing those 5 things: good nutrition, eating lots of vegetables, fruits, nuts, grains, roots, moderate exercise. Walking is man's best medicine, says Hippocrates, who is called the father of Western medicine. I'm making sure I get good, adequate amount of sleep, 8 hours or more per night. I'm learning and I'm still learning, and I've learned how to just relax and chill and center myself and spend some time by myself in quietness and meditation and prayer. And certainly, I have gotten a handle on this water thing. I will drink 64 ounces of water per day. Put some fruits in it to make it taste better. So, yes, in my opinion, and the opinion of many, many health practitioners, doctors, nutritionists, herbalists, the answer, I believe, and they believe, to COVID is to take care of yourself so that your body is able to ward off and protect itself from COVID or any other viruses, bacteria, infection, pandemics that could possibly come our way, because clearly it is those of us that are not in the best of health who succumb to this awful infection called COVID. I have so many friends that are in the hospital setting, they're emergency room and ICU nurses. That is my specialty. And every single one of them have told me that every single patient that they have treated in the ICU and the ER, even though they might be in their 30s and have not been officially diagnosed with a health issue by a medical doctor, they are overweight. And when during the interview, they don't eat healthy and they have a stressed out life. So those are pre-existing conditions, even though no doctor has ever said to them you have high blood pressure and you're anxious and you're depressed and that kind of thing. So these are the people that are ending up in the hospital because their symptoms are severe enough. They're obese, they're overweight, they have high blood pressure, they have diabetes, they have kidney disease, they're smokers, they have emphysema, COPD. Yes, those are the people that are succumbing to COVID. But it's not too late. You can start preparing your body, your mind, your spirit, so that your immune system will be rock solid. Nothing is guaranteed, but at least you will have a fighting chance if this horrible COVID crosses your path. I wrote a book on how we can use lifestyle to heal ourselves. We can use lifestyle to reverse diseases and disorders. We can use lifestyle to prevent illnesses. My book is available on Amazon. It's called Eat, Sleep, Meditate, A Nurse's Guide to Health, written by me, Marva Riley, and you can also get it on my website, rnmarvariley.com. And don't forget to subscribe to my channel if you like this and share the information that is in this video and any other videos that you might watch. You see, our health is our responsibility. It's not the responsibility of the doctor, the nurse, the hospital. It is our responsibility, and we have to recognize that and take the best care of ourselves, because then again, our health is the greatest wealth that we have. And we don't appreciate it until we either lose the health or our health is being threatened. So take care of yourself.